No, I want 3D, I want 4D, I want this D.
Is it possible for someone to use the ultrasound machine without using the gel?
You won't get a clearer image while doing that. X-ray is just basically bones. The baby's position, a professional should be able to identify the baby's gender. Ultrasound machine brings visual representation of the patient's organs instead of X-ray.
The AI app is telling me something else, and what you're saying is not that professional.
What is your clinical report saying? I don't know, maybe that's why they call them patients. Well, you have to be patient with them. Google might be correct. How are we going to explain this with our experience? The more upgraded the machine is, the more sound waves it sends to the child.
The difference between the 2D, 3D, 4D.
Sometimes we convince these patients to do 2D, and that is what is medically essential. It's more clearer. It's like a real life image. 3D is static, so 4D is just 3D showing movements. And my name is Bankole Christiana. I'm a sonographer. I help patients to check their organs using machines.
This program is proudly sponsored by Exodus Holistic Clinic. Welcome to the show.
Thank you, sir.
We have plenty things to discuss about today.
Wow.
Let's start from this one, quick one. What is ultrasound technology?
Okay, ultrasound technology is a mechanism that uses the ultrasound machine to send sound wave to a patient's body to view the patient's organs.
Why do we need ultrasound machines?
Okay, so it's basically to visualize. Ultrasound machine brings visual representation of the patient's organs instead of X-ray. X-ray to bring visual representation, but is not as detailed as ultrasound. X-ray is just basically bones. Ultrasound, you can see the organs like real time. That's like 4D, 3D.
Can you give us an insight of how ultrasound work?
There's an ultrasound machine, then there's a transducer. So the transducer sends sound waves while placing the transducer on the patient's body. You know, there's like something that aids electrical conduction.
Yes.
So in ultrasound too, we also have a gel that aids sound waves to be transmitted like perfectly
into the body,
and that's the ultrasound gel. So the ultrasound gel is placed on the patient's body, and the transducer is placed on the ultrasound gel. Then it can view the image clearer.
So the work of the gel is to allow the sound
to see the organs more. Yes, to help this transducer.
But is it possible for someone to use the ultrasound machine without using the gel? Have you ever tried? Have you ever tried? Is it possible?
It has happened before while doing an abdominal scan, moving from one organ to another. Maybe the gel was not enough or something. You won't get a clearer image while doing that, but you have to add a gel then to get a clearer image. Wow. So it has happened before. It's not like
it's a new thing. What and what can we use ultrasound to get? If someone said, I'm feeling this pain, it is ultrasound that will work for that one.
So there are clinical conditions that you can use ultrasound to check. We have conditions like fibroid, ovarian cyst. Then we have pregnancy is a clinical condition. Yes. So pregnancy, we have pelvic scan for pregnancy 6 weeks to 12 weeks. Then 12 weeks and above, obstetric scan, endometritis, PCOS, polycystic ovarian syndrome. We have several conditions. Those conditions, we see them clearer on ultrasound. Though some lab results might show signs in PCOS, signs of high hormonal profile, fine, but the ultrasound machine will show the eggs that are numerous, that are lined. You get a clearer view in the ultrasound machine. It's just to see it. Since you can get the visual representation, then you know what is wrong and how to deal with it.
Okay, how do you handle patients that when they are asking questions, they are asking you from Google? My AI app is telling me something else, and what you're saying is not that professional. How do you handle patients like that?
The first thing is to be patient. I don't know, maybe that's why they call them patients. But you have to be patient with them. Then explain to them. Yes, Google is correct, but there is something they call clinical correlation, and it differs in some
cases.
people. Yes. So Google might be correct. Google will tell you the symptoms, but what is your symptom? What is your clinical report saying? How are we going to explain this with our experience?
Even if you go to Google and make a research, or you're using AI app, there are times that at the end of the information, they will tell you, they will tell, but Africans, we always neglect
Yes.
that part.
We omit.
Yeah, we omit that part because you're not interested in that part at all. Using ultrasound on patients, do you have a certain age that cannot use ultrasound machine?
From the pregnancy itself, they use ultrasound to check pregnant women, the fetus, and so there is no age that can't use ultrasound. But there are ages that, like, you have to reduce the frequency of the transducer you're going to use. There are different types of transducer, like I said earlier, and they have frequencies that they each use. So for certain age, like pelvic now, we use convex probe for pelvic scan. The more the dimension, the more upgraded the machine is, the more sound waves it sends to the child. So it can affect the child, though it has not been clinically proven. 3D and 4D is not for routine checks, like when you go check your baby. No. Though we are still coming to that. So early sciences like that, you don't want to subject the child to more sound waves, and you just want to use your convex probe and 2D, maybe 3D ultrasound machine, but most likely 2D, just to check for the gestational sac and the crown rump length. So
wow, thank you. I like the fact that you break it down for us.
Yes, sir.
At least to common man knowledge, we can understand what you're saying. So let's go to the difference between the 2D, 3D, 4D.
We've had cases where patients will come in, no, I want 3D, I want 4D, I want this D. But
patients will tell you that.
Yes, do you have 3D? Do you have 3D? So I don't know what they've read. I don't know. They've consulted Google and
a lot of research.
Yes, they want 3D. They want 4D. Sometimes we convince these patients to do 2D, and that is what is medically essential. You still see their baby. The picture is black and white, and it gives you 2 dimension, the length and the breadth. Yes, the bones is more obvious in 2D. Like 3D now is a static
image.
Yes, but it looks more real life. Like it looks like you're seeing your baby. 4D is clearer. 4D will show you every movement. 4D will show you when the baby is yawning, when the baby is smiling. Even some babies, they have a cup. Yes, 4D will show you. You appreciate it more, but it's not medically essential. The doctor wants to see the measurement of the baby, the PPD, the FL, the femur length. They use 3D for fetal anomaly. At least doctors appreciate that more for fetal anomaly, and it's supposed to be done just at least once. It's not a routine check. It's not necessary. So I don't know why people want to use 3D, 4D. They want to subject their child to more sound waves, and those things, they are putting their child at risk. Though they'll be like, they want to see the gender clearer with the baby's position. A professional should be able to identify the baby's gender, but those things are dependent on some factors, like the baby's position. The baby 2 femur might be closed, and you might not be able to capture the genitals well. 3D is static, so 4D is just 3D showing movements, and
it's more clearer than 3D.
It's more clearer. It's like a real life.
So you can record it and send it to your husband abroad.
It will show, yes, 4D will show movements. That is why it will show everything. Like I see your baby.
We're talking about ultrasound, pelvic scan. For pelvic scan, do we need to use ultrasound?
PCOS, I mentioned earlier, you can use pelvic scan and you can use transvaginal scan. I'm coming back to that. So you can use pelvic scan to check for early pregnancy. from 6 weeks to 12 weeks. It's going to be visible. You can use pelvic scan to check for fibroid. You can use pelvic scan to check for endometriosis. So there are some procedures for this scan. It's not that you just come out to do scan.
Okay.
Like pelvic scan now, you have to come with your bladder full. So the bladder makes the uterus transparent so you can see through the uterus. But for obstetric scan, since the amniotic fluid is there is no need for your bladder being full. For transvaginal scan, it's not compulsory your bladder is full. There is a different probe. As I said, these scans, they have procedures. The probe is an endocavitary probe, like it's carved for that space. And it's going to be inserted. It will cause discomfort. Some people will come in, I want to do transvaginal. They don't even know what they want to do. So we explain these procedures to them and they run back because of the discomfort. So some will stay, some will be like, okay, I want to do it. I want to try it out. You will appreciate transvaginal scan if you want to view PCOS. Yes, it's more clearer. And sometimes for early cirrhosis, it's more clearer. Sometimes 6 weeks, you might not see a gestational sac for some people, early cirrhosis. For pelvic scan, in a transvaginal scan, you will see it. It will be very clear. The measurements will be close to accurate.
Another question I have is, for people with infection, can ultrasound work for that?
Yes, we see something in ultrasound when the pouch of Douglas is full. We call it pelvic inflammatory disease. Ultrasound findings. So that's like an infection, definitely. So pouch of Douglas is filled and we record it as is either mild or moderate. That does not mean that when you go to the laboratory to test your urine, your blood, your swab, they won't find a culture there. I mean, they won't find something in your culture. No. We are seeing it there, fine. It's not there, does not mean you are still
safe.
Yes. So that's why you have to collaborate. You have to work hand in hand to know some laboratory findings and what you have to see on the scan. Sometimes it might not be physical. It might not affect the organ. It might just be in the blood. It might just be in your urine. You may not see any symptom, but it's there.
We've been discussing about parts of the body you can use ultrasound machine for.
Okay.
Is that all?
No. You can use ultrasound machine to check your organs like liver, kidney, the spleen. You can also use it to check your intestines, the small intestine, the large intestine, basically the bowel loops. You can use it to check your pancreas. You can use it to check your neck. That's thyroid. That's neck scan. You can use it to check your heart. That's echo.
If you're going for annual general checkup,
yes,
you need ultrasound.
Yes, you need an ultrasound scan.
Wow. We really appreciate the fact that you give your time for our people to give them the information just to enlighten us about the ultrasound machine.
Yeah.
Thank you very much. The great thanks will go to Rivonia Diagnostic and Sleep Center. We appreciate you. They are always trying for us. They will give us people to come and give our people information, because information is power. Yeah. Thanks for watching this episode. Subscribe to our YouTube channel, Naija Health Doctor, and follow us on all social media. Like, follow, and share. We'll see you in the next episode.